Hello and welcome to your Employee Benefit Guide for CBIGG Management LLC, January 1st, 2020 through to December 31st, 2020. The table of contents page shows you where you can find each of the benefits quickly to make them more accessible for you in the future. Please refer to the title and the page number you require. Simply turn to that page. Eligibility for benefits. Employees, if you are a full-time employee of CBIGG Management LLC who works at least 30 hours per week, you are eligible to participate in the CBIGG Benefits Program. Your dependents are eligible for coverage in the CBIGG Management LLC benefit plans if they are your legal spouse or common law spouse in states which recognize common law marriages, children up to the age of 26, dependent children regardless of age as long as they are indicated on your federal tax return. If you wish to change your coverage outside of the annual enrollment period, you must experience a qualifying life event. Examples of a life event are listed below. The elections you make are effective on the first of the month following 60 days from your date of hire. You may not make any changes to your benefit plan unless you experience a qualifying life event. You can enroll in benefits during the annual enrollment period within 45 days of your date of hire or within 30 days of a qualified life event. If you do not submit your elections within the designated time frame, this will result in no coverage for the entire plan year unless you experience a qualifying life event that meets all requirements and timeframes. In order to enroll in your coverage, you must enroll through the website, through Everything Benefits, in order to obtain coverage for the 2020 plan year. Keep in mind that you may select any combination of medical, dental, vision, and voluntary benefits for you and your eligible dependents. Be sure to enter the name of the dependent as it appears on your Social Security card. Make sure you have all of the details for your dependents if you wish to enroll them for the first time, including their birth dates and Social Security numbers. You cannot enroll your dependents without this information. To enroll through Southwestern Payroll in your Everything Benefits portal, you can click on the link highlighted here in blue or go in through your HR portal. Your user ID is the first initial of your last name plus your employee ID. You'll have a temporary password, which are the last 6 digits of your Social Security number. The system will prompt you to change your password, and then you can enter a regular password. Once you're in the system, click on My Account, click on My Benefits, select or review your benefits, and start open enrollment. You may waive options or enroll as you see fit. Select your benefits with you and your family's needs in mind. If you would like to discuss any of the coverages for the enrollment, you may call the Benefit Advocate Center, which is a dedicated resource for you as a CBIGG employee. The number is 844-610-1980 or email bac.cbigg@ajg.com. These licensed professionals will help you make decisions on all of your benefit needs. There are 2 plans available as a CBIGG employee, the PPO plan and the HDHP or HSA plan. The PPO plan As a preferred provider organization, has a very large network and has co-pays for your and deductibles for your treatment plans. The high deductible health plan does not have co-pays. It is a straight deductible plan. Preventative care is covered at 100% on both medical plans. It's important that throughout the year you take advantage of your preventative care for you and your family members. It does not cost you anything to visit the doctor for a preventative screening. Here are the medical plan summaries for both of the plans side by side. The first column shows the Blue Cross Blue Shield $6,000 deductible plan. It also has co-pays. Should you visit a doctor, it will be a $35 copay. For MD Live, telehealth, it's a $25 copay. If you visit an in-network specialist, it's a $50 copay. Emergency room should be sought as a last resort. It's a $350 copay. Urgent care is a $75 copay. Try the MD Live telehealth service first. If you cannot get your treatment and it does not work for you, then approach the urgent care clinic, and as a last resort, go to the emergency room. Obviously, it is more expensive to go to the emergency room for you and the company. For the HSA plan, the deductible is still $6,000, $12,000 for a family. The most you could possibly spend in a plan year is $6,000 or $12,000 for a family. Please note, on this plan, there are no copays. Everything goes towards your deductible. If you would like to use the MD Live telehealth service, the average cost is approximately $45 for each visit with the telemedicine doctor. You will not have prescription drug copays underneath the high deductible healthcare plan. With the copay plan, you have a $10 copay, 30% up to $50 maximum for preferred drugs. For non-preferred, it's 50% up to $100 maximum. And for expensive specialty drugs, it will be a $60 copay. For full benefit information, please see the website or ask your HR team and they can send you a full highlight sheet. This is just a brief overview of the two plans offered. As a Blue Cross Blue Shield of Texas member, you can access all of your employee information, your ID cards, and your explanations of benefits on the Access for Members website. It's called Blue Access for Members. The website is here on the right, bluecrossblueshieldoftexas.com member. You can sign up and order any of your ID cards, find out what your account balances are, your claim status, and more. As an added value discount program, you can review blue365deals.com to purchase any lifestyle or wellness products that they have available for you to stay healthy for less. If you enroll in the high deductible health plan, an HSA bank account is portable and allows you to carry over money from year to year. The money that you put aside into your HSA bank is usable for any of your deductible expenses as long as you are enrolled in the HSA bank account plan. You can put aside an annual contribution of $3,550 for a single person or $7,100 for a family. If you are over the age of 55, you can put an additional $1,000 into your HSA contribution account. HSA contributions are deducted on a pre-tax basis. For any questions, please call 1-855-731-5220 or visit the website hsabank.com. Below is a list of qualified medical expenses. For example, your deductible, prescription drugs, dental care and vision are all included as qualified medical expenses. Below is a list of what are not covered underneath the HSA plan. This is a summary of your dental and vision benefit plan summaries. In the dental plan is 3 options through Emeritus as the insurance company. To find a provider, go to emeritus.com, click Find a Provider, scroll down on the dental drop down, choose a network. The network is the Dental PPO Benefit Network. There is a low, middle, and high plan. The main differences on the plan are the annual maximum. This is the most that the insurance company will pay. If you're in the low plan, they will pay $750. If you're in the middle plan, they will pay $1,500 a year. If you are in the high plan, there's $3,000 a year. In the middle and high plan, orthodontia, braces, and other such medical treatments are available for children to the age of 19, but only available on the middle and high plans. If you wish to discuss your decision on which plan, please call the Benefit Advocate Center and they can help determine which plan is best for you. The voluntary vision is also through Emeritus. Below is a brief summary of the plans. You can have an annual exam every 12 months. You can have a new set of lenses every 12 months and a new set of frames every 24 months, every 2 years. As with all benefit programs, it is best to stay in network. It will save you money and ultimately get you to the best place of care. The exam copay is $10 and the lens frame coverages are $10 copays. If you go out of network, they will only pay up to certain amounts if you were to go out of network. So please try and stay in network. If you need help finding a provider that is in the network, call 1-800-255-4931. Emeritus will be happy to help find a provider. This page outlines the deductions for 2020 that will come out of your check on a monthly, semi-monthly, or weekly basis. Find whichever plan it is that you think you want to enroll in, and each amount will tell you how much will be taken out of your paycheck. The system that you'll be using through Everything Benefits and Southwestern Payroll will automatically calculate your elections based off of these amounts. There are a number of voluntary insurance programs that CBIGG wish to offer you. CBIGG does not contribute to the premium. These are purely on a voluntary basis and will be deducted from your paycheck. The amounts that will be deducted are listed here below. The benefit plans for this is a voluntary accident insurance through Sun Life. If you are admitted to the hospital, they will give you $1,000. If you're admitted to ICU, it's $1,500 per person per year. Every day you spend in the hospital, it's $200 up to 365 days. If you're in ICU, they will pay you $300 up to 30 days. If you go to the emergency room, there's $100 reimbursement. Urgent care is $100 reimbursement. For an x-ray, $150. Ambulance or air ambulance is $200 or $1,000 respectively. For a fracture, $900 reimbursement, and so on. This is not the full list of reimbursements. These are just the most common reimbursements that we see. Please refer to the plan documents to see the full list for voluntary accident insurance reimbursements. It's the voluntary critical illness, again through Sun Life. This is a voluntary employee benefit. CBIGG does not contribute towards the premium. This pays cash directly to the policyholder in the event of a critical illness. Should you get your annual wellness screening, you are eligible for $50 of wellness credit. They will send you a check for $50 just for taking part in your preventative care screenings. As we mentioned previously, you do not pay anything for those screenings through Blue Cross Blue Shield. You can elect anything from $5,000 to $20,000 of coverage in increments of $5,000 with no questions asked up to $20,000. If you were to elect, for example, $10,000 and you were to have a heart, stroke, or cancer, they would pay you $10,000 to help with your claims, your bills, to help your family get through the situation. There's no waiting period over here for any of these conditions. If you cancer, non-life-threatening cancer is a 30-day waiting period, as are these conditions listed for childhood conditions as well. This is not a full list of benefits. It's not a full list of schedule. Please refer to the SPD or the plan description so that you can see exactly all the conditions that are available. These are the rates for you and your dependents should you wish to enroll them. For example, if you wish to have $10,000 of coverage and you are 50 years old, it would cost you $15 per paycheck. These are on semi-monthly payroll deductions. If you are on a weekly pay schedule and you want $10,000 and you are 35 years old, it will cost you $1.78 per week in order to have access to those benefits. The Southwest payroll system will automatically calculate this for you once you make your election. With each of the medical plans that is issued through Blue Cross Blue Shield, you can have a voluntary gap coverage plan through Sun Life. The voluntary gap insurance is there to provide you with money to pay for your deductible and co-insurance. This product is only available if you are enrolled in the Blue Cross Blue Shield PPO plan. You may not be enrolled if you have the HSA or high deductible health plan. This is purely designed to help you pay for those expenses if you are admitted to hospital. Here are the deductions for each of the benefits if you're on a semi-monthly or weekly payroll. An example would be if you just wish to enroll, if you're 45 years old, they would take $36.34 every paycheck. If you're admitted to hospital, they will pay $1,500 for your plan, for your benefit. CBIGG provides you with the opportunity to buy voluntary life, accident and dismemberment insurance through Sun Life. You can enroll up to 5 times your earnings to a maximum of $500,000. If you elect more than $150,000, There will be medical questions that you will need to complete to prove good health in order to obtain higher coverage limits. Anything under $150,000 will be guaranteed issued and no questions will be asked of you. These are voluntary benefits that will be paid for by you out of your paycheck on a weekly, semi-monthly, or monthly basis. Voluntary short-term disability is designed to help pay and it will protect your income for up to 13 weeks if you are disabled due to illness or non-occupational injury that prevents you from working. This will help you pay your bills, car payments, mortgage, etc. You can get a weekly check of $100 to $1,000 in $50 increments up to 60% of your weekly earnings. Voluntary long-term disability is also offered through Sun Life. This is to be paid for by you, the employee. You can get a monthly check of $500 to $5,000 in $100 increments to replace a portion of your income up to 60% of your total monthly earnings. Both the short-term and long-term disability are there to help you protect your income if anything were to happen in the event that you would become disabled. The following pages are legal notices. Please review when you have the chance. These are also posted on your benefits website for you to review at any time throughout